When I was a COVID community health worker, one of the ways that we made sure that our data that we were getting from the CDC, from the state, from local officials, from the IHS were usable and understandable by the general Indigenous community was by making graphics and by making sure that all of these overwhelming stats that we were getting from multiple sources were given out in a trauma-informed manner. One of the reasons why it was so impactful to have COVID community health workers that were from the community is the fact that we were able to build trust with members who may not have sought our services otherwise. Native CHWs were so important not only because we were a part of the community and we were serving our own community, but because we were able to transmit back community data, firsthand experiences from the people we were serving back to the community, to the state, to the federal levels in order to make sure that our communities were getting the services that we needed.
We went through this experience as an organization, as a community, because we are out there on the front lines collecting information. We saw them come out to protect each other. We saw them come out for first and second vaccinations. And we delivered that information to OHA. We delivered that information to the county, and they were there to see it. And when we saw the numbers, it was not what we were seeing in the community. We know that this is something that has historically happened to our people, but in real time, we saw it during the COVID-19 pandemic. Federal systems have different ways of interpreting data from Native communities. The state does too. OHA has different data analysis. County systems have different way of looking at data. Each of these systems, each of these structures have large departments that interpret these data, and within those departments are people who are not familiar with our communities.
When the actual numbers come into county and state databases, they're then disaggregated into different groupings. And we see that county levels, that state levels, that federal levels all use different aggregate methods, which often leads to very confusing statistics that may not line up between different sources.
Whenever different organizations and different health departments collect your data, there's a variety of methods that they use to aggregate it or disaggregate it. One of the ones used by OHA, the Oregon Health Authority, is rarest race, which might seem a little bit odd. It's only used for COVID and flu. But what they do is they take the race and ethnicity data that you've reported and they choose the rarest one. And then they use that as the numerator. It's divided by the denominator, which is the entire statewide population of said race. And so each place that breaks down rarest race will give you different data, which means that data is not comparable unless you know how it was collected and what it's comparing itself to. There's an order of the rarest race in Oregon. The first one is Pacific Islander Native Hawaiian, followed by Black African American, then Native American, Native Alaskan, then Asian, Latino, Hispanic, and then white, and then other. And so say that you put down on your Real D information that you're African American and Native American. You're gonna fall into the African American category, not the Native American category, because that's the rarest race. But all other immunizations in Oregon, you've put everything that you put down on your Real D information, you're put in each of those categories. And then you have the Hispanic First Disaggregate method, which is a new method that's starting to come about. Before, we couldn't really identify the populations that needed to be identified, so there was a lot of inequity in the Latino community.
Hispanic disaggregate, or Hispanic First Disaggregate, means that people who mark themselves as Hispanic or any form of Latinx are often filtered out first and then separated into the different racial categories after that.
That's why in 1997, the census actually broke it down to where there was race and ethnicity. But they've realized that there's an issue with that now, because a lot of Latinos don't see themselves in the race category. And the issue that comes with that is they don't choose anything, or they choose white, or they choose some other race. And if you don't choose anything, or you choose some other race, then a race has to be chosen for you in the census. And so then you're just automatically put into the white category, which is why it's so important to fill out this identifiable data, because then your community can be counted and resources can be allocated to you and your health care can be tracked to make sure that the community is getting served as well as it needs to be.
Both data analysis methods, both rarest race and Hispanic disaggregate, lead to indigenous erasure, which is also a form of data genocide.
There's also the any mention approach, which is mostly used in mortality rates, but it's also used with all the other vaccines in Oregon. It's any mention of any race is put down, and so you fall into each category. With mortality, it's any mention of any disease, and so then you're put into those categories for why you passed away. It's absolutely a less than perfect science. No data is really comparable with other data unless the same approach and the same numbers are used. And so like say you take statewide data and you're trying to compare it to county data or city data, the denominator is going to be different. The numerator is going to be different because there's different size populations. And what happens with the smaller populations is if there's not enough people to make a comparison, then that entire population is just left out of the data.
We know our communities and we know our people. We know that there are really important stories and information embedded within our communities, and sometimes that story can't be told unless it's with a trusted person. For instance, if I wanted to collect some information from a community member who maybe had a bad experience with government systems or didn't trust certain people or systems, then they're not going to give that data, or they're not going to show up for a study or a research project or answer survey questions. But they might if the person was from their community, looked like them, and they know the purpose and collected that in a really respectful way. Unfortunately, many times people don't trust community collected data. They look for, is this published? Is this something that is collected by someone with a doctorate degree or a professional research person that's from a university? And that's not the case with community collected data. We need to have more researchers. We need to have more community members in these spaces where we're collecting data. I'm looking forward to more of our community being involved in data and not being scared to collect that information, but knowing that it's really important that we tell our own stories.